This recording will go over fatty liver and liver trauma. Fatty liver is caused by the accumulation of fats in and around the hepatic cells. It may be caused by alcohol use or other factors. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis are types of fatty liver disease. Causes include diabetes mellitus, obesity, elevated lipid profile, and genetic factors. Fatty infiltration of the liver may result from faulty fat metabolism in the liver and the movement of fatty acids from adipose tissue. Many patients are asymptomatic. The most common and typical finding is an elevated ALT and AST or normal ALT and elevated AST. MRI, ultrasound, and nuclear medicine examinations can be used to suggest excessive fat in the liver. A percutaneous biopsy can confirm the diagnosis. Interventions are aimed at removing the underlying cause of the infiltration. Weight loss, glucose control, and aggressive treatment using lipid-lowering agents are recommended. Monitoring liver function tests is essential in disease management. The liver is one of the most common organs to be injured in patients with abdominal trauma. Damage or injury should be suspected whenever any upper abdominal or lower chest trauma is sustained. The liver is often injured by steering wheels and vehicular crashes. The liver is a highly vascular organ and receives almost a third of the body's cardiac output. When hepatic trauma occurs, blood loss can be massive. Observe for early signs of hypovolemic shock. An ultrasound or CT scan of the abdomen is often done to determine the presence of a hematoma. A decreased hematocrit may confirm suspected blood loss. Clinical signs and symptoms include right upper quadrant pain with abdominal tenderness, distension, guarding, and rigidity. Comfort alterations exaggerated by deep breathing and referred to the right shoulder may indicate diaphragmatic irritation. Please review the chart of key features of liver trauma in your textbook. Liver trauma is managed in a conservative manner through new diagnostic and therapeutic modalities such as enhanced critical care monitoring and damage control surgery. The condition of the patient, grade of liver injury, and presence of other injuries will determine the management strategy, which is whether to operate or not. Patients with hepatic trauma may receive multiple blood products such as packed red blood cells and fresh frozen plasma, as well as massive volume infusions to maintain adequate hydration. Monitor the patient after surgery for persistent or new bleeding. Closely monitor CBC and coagulation studies for trends and changes.